What did I just say?
You just said the higher it goes, the better your lung capacity.
Your lung capacity
Which could be an indication of your lung function.
of your lung function. What in the world does capacity tell me?
Volume.
Of volume. Okay, so now that you're kind of understanding that, all right, spirometry is going to be used as a measurement of the ventilation, the breathing in and out, to help assess the severity of a respiratory disease or to monitor improvement or deterioration. For example, somebody has surgery. They've been put under general anesthesia, okay? What do y'all know about general anesthesia?
Takes a while for it to leave your body.
Takes a while to leave your body. Do what?
Slows everything down.
Slows?
Respiration.
Only slows?
Actually, turns it off.
It stops. Does it
It stops.
Synapses, doesn't it?
It's going to stop these little things called our nerves and little impulses that we need to carry. It's the reason they got to put a tube down your throat and keep you awake, keep you breathing. Now,
Not all anesthesia.
huh?
They don't do that for all anesthesia.
The ones that are major,
Yeah.
general anesthesia, okay? Some things now are done with that little, what is it, Versed? There's some kind of medication now that they can give you. But if you have to be under anesthesia, one thing about anesthesia, it stops processes in the body, okay? I don't know about y'all, but if you've ever had general anesthesia, just to give you an example, how long does it take you to start going to the bathroom afterwards? And I don't mean number one.
3 to 4 times.
3 to 4 days. Okay? And it's no fun.
Is that why you're cold when you wake up? My surgery was 6 hours long, and I remember when I woke up, I was just freezing.
Well, they keep the surgery room cold also.
I
But
know
yes,
that.
your body temperature is going to
Yeah,
drop
I had
too.
to put like 3 blankets just over my entire body.
Yeah. When you wake up, for the ones that have had heavy surgery, like they make your mom do it, Megan? Did they have the little breathing thing?
She's still doing that.
Okay.
She definitely did it in the hospital and in the inpatient, but they said it was to help her not get pneumonia.
Right, because they're making you make those lungs
Right.
function.
She had to like keep a ball in between.
She had to keep it between a certain number. Exactly. Okay? And if you can't do that, then they're going to know there might be a problem on the horizon. So that would be monitoring an improvement. Okay?
But even if your surgery was unrelated to your lung function, you still have to do it, because I did it after my surgery.
Yeah.
But why would that
Because
be
you were under general anesthesia for a long time.
and so the general anesthesia could affect it.
Oh, yeah. When I say shuts down, it
I thought
shuts down.
I had the rotator cuff thing, and I was out for 3.5 hours for that surgery on my shoulder. And they actually, and I had to have a second one. And the first time, because they did a nerve block also
Mm-hmm.
in my neck because of the pain from it,
Mhm.
I had such a hard time with, getting breath and breathing. And then the second time they wanted a student to do my nerve block, and I went, oh no, sorry, I'm not having a student. I want the anesthesiologist doing it. I do for the nerve block because
They do it after you were put to sleep.
they do it. They start it as you're starting to go under. They.
The nerve block.
Mhm.
Okay.
I didn't have to do that. When I had my knee surgery, I didn't.
Well, I think it's
When
about.
you have knee surgery, the nerves shut down anyway, and it's a protective feature in the legs. And when that happens, you have to have those nerves wake back up, and that's why they do the physical therapy and they do the little neuromuscular junction stimulator and all that sort of
No,
stuff.
I didn't have to do that though.
No, because we were only under probably an hour.
Oh, I was longer.
How long?
3.
3.
It was supposed to take an hour.
They did a bunch of
And they
stuff
realized I
on me,
had-
it sounded like from that
Yeah, I had really bad
experience.
cartilage.
Okay.
All messed up.
Maybe they had you under the other medication, not a full
They told
general.
me it was whatever Michael Jackson was
Yes,
using.
that's not,
Yeah.
that's not full, that's
I
not
love
a full
it.
general.
Yeah, that's what this is.
Yeah.
No,
No,
love
that's
it.
like,
don't give me
Could be
too much.
a-
yeah, so that's what, what's the name of it? I can't remember the name of it. Huh,
Propofol.
Propofol, okay.
Yeah, that's what I was.
And
That's
so,
not
and see, that's what I was under too, and basically that's not shutting everything down.
Oh, okay.
Yeah, so for
My
like,
nerve block lasted though like 4 or 5 days, and then when it wore off, oh God, the pain! Like it was that, oh my Lord, this is horrendous.
yeah,
And I had that ice circulating constantly.
Does a nerve block work the same as an epidural then?
sort of,
Do they keep like the catheter in there?
No,
No,
Mm-mm.
it's
Yeah.
just like a shot.
My mom had an epidural and was under general anesthesia.
So that she wouldn't have as much pain when she woke up. That's what the epidural was for.
How is she doing?
She's doing really well. I talked to her
That's
this
good.
morning. She has the PT at the house
Okay, yeah, and when they come in, they're probably doing this. They're probably getting her to do this and check it. Okay, so what it does, okay, spirometry is going to use this thing right here, the spirometer, and it recaptures an expired breath, meaning it's the breath that you are exhaling out. We use it to help determine the rate, the depth of breathing, what is the speed of that person exhaling, and that can have some math be done to help determine the rate of the oxygen consumption. There's a list in your textbook that talks about the factors, representative measurements, not factors, but the measurements that would be considered normal for an adult, okay? And when we begin to think about what can affect some of those measurements, well, age is going to affect it, your gender, which is why I keep struggling to just say the adult, because a lot of what they focus on for the norm is based on a healthy adult male. Okay, so roughly one that's not overweight, one that's at a good weight, somebody who has good physical activity, all of this blah, 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 roughly in their 20s. Okay, that's where we get the norm range for these measurements. But your body size, your age, your gender, your physical conditioning, all of these will have a, basically have an effect on what your respiration might actually be for your body. We can see that the volumes, they will change from person to person, and for the most part, under healthy normal conditions, they're going to fall within that norm range that you see in your textbook. Now, when we talk about this lung function, this volume of air, the capacity, okay, a female's air, okay, a female's pulmonary function is going to be less than a male's. Don't ask me why, okay? I don't know, but your gender actually affects what your norm should be. And in the healthy adult male, okay, and then what they have for the norms for females, vital capacity, they always are going to have a maximum. So the volumes, your textbook is going to get a little detailed about these volumes and some math that's involved, okay? We are not going to get that detailed, but I do want you to be familiar with the terms, because these volumes, okay, they are clinically significant. All right? They're clinically significant because of the math that can be done. And that can be indicative of either normal function or something pathological. So when we talk about a volume, this is referring to the volume of air that would be normal within the lungs, okay? We have what's called tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Well, we get real inventive, all right? This one, TV, this one, IRV, this one, ERV, this one, RV. Yeah, let's go take a trip. Okay, just say it. There is a volume of air that is associated with each phase of the respiratory cycle. What is the respiratory cycle?
One breath in.
One breath in and out. So one cycle of inhalation and exhalation. That is a respiratory cycle. And there is a volume of air that is associated with this respiratory cycle. We can measure these volumes, and lung volume we directly measure, meaning TV, IRV, ERV, RV are directly measured in that spirometer. Is everybody following me? Now, the capacity is inferred. What do I mean by inferred? If the volume's directly measured, what do I mean by inferred?
Well, capacity is volume, right?
Well, let's go sort of with assume, okay, where we're going to have to take the numbers from the volumes to try to determine the capacity.
Two or more volumes.
Two or more volumes, because that'll lead us to something about the capacity of the lungs. Here we go again. The average lung capacity of the adult male is about 6 liters of air. Think about that.
Can you say that again, the average?
The average lung capacity of an adult male is about 6 liters of air. The average respiratory rate in the adult is about 12 to 20 breaths per minute. The average respiratory rate in adults is about 12 to 20 breaths per minute.